So I guess honesty is the best policy.
Why'd you say that? Seriously, to establish your viewpoint as if I didn't already know it? It demonstrates some weird cross-generational female solidarity with Cuddy.
Actually, I was just trying to fill the awkward silence.
Why have they stopped?
You can't go out there.
Why did you stop?
Get out of the hallway.
He does not have smallpox.
Yes, he does.
It itches.
He's just developed pustules. He's now too dangerous to transport. Get out of the hallway.
Dad's vitals are in the toilet. He's got full-blown smallpox.
What about the daughter?
Pustule count is way up, vitals are way down.
Means I was wrong. To be precise, I was right before I was wrong, so.
So we just give up and go home?
Actually, somebody locked the front door, but yeah, we give up.
We might as well
We have our diagnosis. If you're eager, you can go find us a new case.
Guess she's eager or has a blind spot for sarcasm.
I just want to look at the rash under her arm to see if it's matured.
You
so
can
that-
look through the glass.
I need to be closer. If the pustules are at a different stage...
She's comfortable. We're gonna have our results back in 8 hours. If it's not smallpox, you can be the first one in there.
Why are you just standing out there? I'm just trying to help. If you're feeling up to it, can you sit up and show me the rash under your arm? Wait. The soles of your feet. There aren't any lesions. Who cares? Everywhere else this is torture.
DDXing at this point, it isn't gonna make a difference.
Don't say that.
I'm sorry. House, you screwed up going in there.
You have any fever?
Not yet. But when it does come, I assume you'll see the pettiness of being mad at me for lying.
Shut up, House.
I'll be right back.
I'm not gonna make it at my...
You should say goodbye to your family.
I love you.
Just hold on. Fight this.
You gotta take care of my boy.
No.
You promise me. I love you too. Get Roger closer.
Come closer. Come on. Dad.
My baby boy.
Dad, please.
You're gonna be okay. Lulu's gonna take care of you.
I don't want to, Dad. She's not you.
I will always love you, Roger.
Dad?
You're killing me!
The suit will protect you if you haven't already been exposed.
My air supply's almost out.
We'll give you another canister.
Yeah, and when I change it, I will be exposed.
Just move him.
I wish I could.
Oh, that's great. So you know what you can do? You can move me. You don't know that I have smallpox yet.
We have to assume.
There's another isolation room on the 5th floor.
The problem is getting him from here to there.
So it's inconvenient. My having a fighting chance of life is inconvenient.
I'm sorry.
Just start them on doxycycline.
Based on a bald cat? You never heard of shedding?
What's the downside?
If we shove her full of antibiotics, plus the antivirals, it'll suppress her bone marrow.
That girl's about to die.
She probably is, and I don't want to risk pushing her over the edge.
At least look at the dad's body. Small patches of black dead tissue will prove I'm right. Eschars appear with rickettsial pox, but not with smallpox.
If he had developed eschars, I would have noticed.
You haven't been within 20 feet of the guy in hours.
Have them check.
Their job is to bleach the body, kill the virus, and get it out of there for Dr. House's sake.
Bleaching the body will destroy all evidence of rickettsial pox.
There is no evidence. I'm not trying to hurt anyone here. I'm not lying to you. This is smallpox.
House, you have to examine the body.
I'm not going anywhere near it.
Look for eschars, hurry.
You think it's our pox?
The captain had a cat. He lost his fur and then died.
Step back, Dr. House.
It's kind of hard to do an autopsy in oven mitts.
Take him off.
Says the woman standing behind 2 panes of glass.
Do you believe me? Forget me. Do you believe you? You think it's rickettsial pox, don't you? If it is, it's curable, and she's gonna die unless we can prove it.
You really are annoying.
Come on, House, come on.
Eschar. Eschars.
Start the girl on doxycycline right now.
Matt, did you take any drugs this morning?
Pencils down.
Can you squeeze my fingers for me? Did anyone give you anything to help with the math test? Matt?
I told you, he doesn't take drugs.
Miss Davis, all parents think that about their children. And they're usually wrong. I gave my mum a little trouble when I was his age. I turned out okay. Even she thought so.
I know my kid. The fact that you did drugs doesn't mean he did.
Did he go anywhere last night?
No. He was home studying.
Any friends come over to help him?
And bring him drugs? Is that what your friends did?
Miss Davis.
Look. I tested him myself. The home kit. I took some hair off his brush. I didn't want him to know about it because I do trust him.
Then why did you test him?
All he did last night was study and argue about his college interviews. He wants to be himself. No haircut, ratty old clothes. That'll go over big. Then we both gave up and went to bed. That's it.
Has he ever had any problems like this before? Any family history?
No. It's just me and Matt.
Diazepam, 10 milligrams, start.
Right, what's going on?
Taking some precautions. He's seizing. The poison's called disulfoton. This should bond with it and neutralize the poison. Then his nervous system will start sending the correct signals to the rest of his body.
But there was no well, that stuff in that can.
The label says disulfoton. I can show you.
But you didn't test it.
You said Matt sprayed with it this morning before school.
Matt started that garden himself for an environmental science class. They weren't allowed to use pesticides.
Apparently he cheated a little.
It was orange peel oil, totally organic. He dumped that other stuff last winter.
The symptoms fit. There must have been some left in the can.
If you're wrong, what will this treatment do to him?
Well, theoretically, it could increase the toxicity and... But we're not wrong.
Don't.
We're not wrong.
I can't let you do this.
Get a court order. Unless you want to see someone killed by sheer irrationality.
Maternal instinct is always irrational. Doesn't mean it's wrong.
Actually, that's the definition.
It doesn't make her mentally incompetent.
She is risking her son's life based on a teenager's claim that he washed something. How mentally incompetent can you get?
That's a brilliant legal argument.
Listen, have your Harvard law dog whip up some high-grade legal-sounding psychobabble. Temporary insanity brought on by acute panic distress syndrome. I don't care. We have to give him the hydrolase.
Her only sign of mental illness is that she disagrees with you. Some would consider that a sign of sanity.
Not the kid. Let's ask him. Oh, no, I forgot. We can't. He's dying.
Get the mother to sign off that she's refusing this treatment.
Goodbye. I, Margot Davis, have been informed of the risks which may arise from my refusal of advised medical care. I hereby release...
Who are you?
I work for the hospital. The Princeton Plainsboro Teaching Hospital and its employees, agents, and otherwise from any adverse medical conditions resulting from my refusal. It is not the hospital's fault if my son kicks off.
Kicks off?
I punched up the language, mostly for clarification. I understand my doctors consider my decision to be completely idiotic.
Why are you doing this?
But I am convinced I know more than they do. I took a biology course in high school. I assume that's... yeah. Besides, I enjoy controlling every single aspect of my son's life, even if it means his death. Sign here, please. I brought a pen.
Who are you?
I'm the doctor who's trying to save your son. You're the mom who's letting him die. Clarification. It's a beautiful thing.
My God, the things he said.
Dr. House wanted your son to get the medicine he needed. He was willing to do whatever it took to make that happen.
The wrong kind of medicine.
He didn't know that. At the time, it was our only choice.
He would have known if he had listened to me.
He listened. He just assumed you were wrong. To be honest, that's true of most of our patients.
You're just as pompous and superior as he is.
The county's worried about West Nile, so they sprayed ethyl parathion right next to the bus route.
Do you have the hydrolase for ethyl parathion?
Yeah, only one problem. Matt's mother faxes records to the CDC. She refuses to let us do anything until she hears back from them.
Well, you're getting good at this godlike doctor racket. Why don't you talk her out of this lunacy?
She's not really a big fan of mine.
Or mine.
Well, only one man left in the bullpen, and he throws like a girl.
I hate sports metaphors.
Give her the high, hard one.
We really think the hydrolase is the only...
I'm thinking about transferring that out of here.
Miss Davis, your son is very sick. He won't survive a transfer.
I'm getting a second opinion from the Center for Disease Control.
Right. Look, when my grandmother got sick...
What? You're gonna tell me some tough decision you had to make?
I know how hard this is for you.
Maybe embroider the story a little, make it fit?
I can't imagine being in your position.
Honesty, a kind of vulnerable honesty. That's your thing. And the looks.
Boy.
They send a single woman to hustle the single mom.
Actually, they sent a doctor to tell you that if your son doesn't get this treatment, there's a good chance he'll die.
That's what House said about a treatment that would have killed Matt. You've got to do better than that.
No. It's on you. You need to do better. Right now. Yes or no?
I don't know.
Figure it out.
Wait.
I never bother to wash new clothes before I wear them.
Right. Your wife does. She likes you feeling nice and comfortable.
Hey, I'm a man. I don't have time for laundry. I'm saving lives here. No, she doesn't wash them either.
So your skin absorbs a little dye, the odd chemical here and there.
Well, you know me, Mr. Living on the Edge.
Judging by the self-importance of your strut, you have identified the chemical in question.
Fostrin.
Hit him with the hydrolase.
She's parents said yes, but...
Mighty mom said no. She's gonna feel like $1 million when she lives and her son dies. Send Cameron. She's the only one of you who's managed to talk her into anything.
Not this time. Matt's mum won't make a move until she gets that opinion from the CDC.
Godot would be faster.
What is this?
Thought I'd hang out. In case you change your mind. And I could give Matt the medicine right away. Don't worry, I've got time.
The CDC promised they'd call.
I'm sure they will. Maybe tomorrow, maybe the day after. It takes time to review faxed records. And they'll probably tell you they can't make a decision based on faxed records. This is Susie. She's never gonna marry him. No money.
What makes you think you're right this time?
Same reason as last time. If you want to see how the other kid does first, that's okay. Might help you. Although there's a real good chance that
What? Matt might kick off?
it's a little blunt. I was gonna say run out of time, or just kind of let my voice trail off.
Hello? Yes, this is Margot Davis. But you have his records. I sent them. Yes, I understand.
You guys gonna join us for dinner Thursday?
Gotta do my laundry.
You're not curious?
Curious about Crocs, but I don't stick my head in their mouths.
I'm out, too. But House is a freak. There's no virus that causes that, no DNA mutation. You're gonna have one dinner with two people, 60 minutes, most of it spent chewing, talking about the weather. Unless they say something like, do you prefer the Chardonnay or the Merlot? You know, we kept Greg locked in the closet for 17 years. You're not gonna learn anything.
Okay. We'd like to talk to some of your friends, see if they have any similar symptoms.
The doctors in the ER already asked me that.
We understand, but they didn't have all the information that we have now.
What kind of information?
Would you mind if I spoke with Carnell alone for a minute?
Is this bad news?
No, it's just confidential.
Why is something suddenly confidential? I mean, if you know something about my son, I need to know what's going on.
I'm sorry. I have to insist.
I'm his father. And if I'm going to take care of him, I need to know the truth.
Dad, she wants to know who I went to Jamaica with.
You've never been to Jamaica?
Teddy's dad flew a bunch of us down over spring break.
You told me you had 2 papers to write over the break.
Because I didn't want to come home and work my ass off. I wanted an actual break during the break for once. I shouldn't have lied to you.
No, what you should have done is come home instead of partying with your rich friends.
I'm sorry. We need those names.
What's wrong? His stomach's getting a lot worse. It's rigid.
He's bleeding into his abdomen.
What's going on?
We need a surgeon in the OR stat.
On it.
Try to hang in there, Carnell.
The infection caused a perforation in your sigmoid colon. It's repairable.
But it means the antibiotics aren't working.
Double the dose and add Tigersil to the list.
As soon as he's out of surgery.
Where's Richie Rich?
He said he can't leave work.
Yeah, you told me that 2 hours ago.
I'm not gonna lie.
Why, because it's wrong? Or because you're a coward?
Tough choice.
You'd be wasting 2 hours of the kid's time. Is that deeply and unforgivably morally wrong? No. Because it's not a waste of his time. Unless we're wrong. Unless his condition's got nothing to do with his friends. You're just afraid of being wrong.
Your parents called. They had to catch it earlier.
You don't have to lie to him. Kid's on his way here.
He got off work?
Yeah, by vomiting blood. Ambulance is 10 minutes out.
Mr. Hall, it's not good news. The piece of metal that you gave Carnell was from an industrial device used to test wells. People aren't supposed to just dump radioactive material.
But they do. So what now? I mean, what do you do?
Anyone who's had contact with the source will have to immediately get treatment for radiation sickness. Taddy carried it on the slab on the flight.
So there is a treatment.
Transfusions. And we try to get the fluids and electrolytes balanced. Carnell, he's had much more exposure. The equivalent of about 70,000 chest x-rays. His ability to create white blood cells has been completely destroyed.
And that's why he can't fight off this infection.
Yeah. He's gonna need a bone marrow transplant. And we did another PET scan. There's a cavernous angioma within his spinal cord. It's a tumor. That's what's been causing the shocks and CNS symptoms.
He has a tumor inside of his spinal cord.
The cord is made of strands put together, sort of like a kite string. The surgeon should be able to pull the strands apart and excise the tumor, but surgery on someone who's as hemopoietically compromised as your son is extremely risky.
And, if you don't do the surgery, I mean...
The tumor could cause his breathing to stop. Possibly his heart as well. Look, there's no way you could have known. You're gonna have to come with us. You need to start treating yourself.
No. I can start my treatment later.
But he can't. He needs to be in a sterile isolation room to prevent further infections.
Thank you. Ooh. Ooh. So how much longer do you think he'll be in surgery?
It's hard to say.
You know, He just started school when Ann died. I was a mess. Still adjusting to being a parent, much less a single parent. You know, I used to put cold pancakes in his lunchbox. I mean, that was the only thing I could make that he would eat.
You did okay. He's a good kid.
Oh, hey. So how is he?
Well, the surgeon has removed the tumor without damaging the spinal cord, but the infection has caused another intestinal perforation. We stopped the bleeding, but his white count keeps falling.
Okay. So what now? Another drug, antibiotics, what?
I'm sorry. The reality is, no matter what we give him, it's unlikely he's going to be able to fight off the infections.
Okay. Hey. How you doing?
I'm hanging in there.
I'm sorry I lied to you about Mom.
I'm sorry I lied to you, too.
There was nothing good that came out of her dying.
I'm not mad. I know why you did it. It worked. I never drink and drive. I'm scared, Dad.
Come on. There's nothing to be scared of. You're gonna be just fine.
Don't play me. I want to know the truth.
I'm telling you the truth. You're gonna be fine. I swear.
I love you, Dad.
I love you too.
Since the accident, he's had
Yeah. Sore my legs. Hey, someone talk to me. Hey, you don't hear me talking to you?
great heart for transplant.
Who? My heart? Oh, God. They don't know I'm in here.
Hey, genius. I think it violates certain ethical laws to rip the organs out of a guy who's still alive. Possibly
Thank
certain
you.
law laws, too.
Thank you.
Could you,
get back in your bed, please, Mr. House?
It's actually Dr. House.
This guy's a doctor.
There's also Navy SEAL House, but you're gonna have to save up for that one.
Really? Well, that's interesting, but you're here because you crashed your motorcycle, not because I need a consult, so get back in bed.
Scrape my elbow. Need a truckload of Vicodin. Where's this guy?
He's brain dead.
No, I'm not.
So drop it.
See that?
Minimal brain waves don't mean he's alive.
I am alive. I'm here.
EEG response to painful stimuli, hot or cold. What you're seeing is random, barely discernible.
I discerned it.
Listen to him, please.
No, that's just the amplifier's internal noise level. It's on increased sensitivity.
No, it's not. It's me.
Then why is his eye following me?
Exactly.
Following motion's an involuntary reflex.
No.
You're a doctor. You should know these things.
No, I'm not dead. I need help. I'm here.
I also know about locked-in syndrome. That things are either involuntary or voluntary. Blink if you can hear me.
I hear you.
Oh, this is gonna be fun.
Eye movement is deliberate. Can you blink once for yes, twice for no?
I hope so.
Square root of 9? You got that faster than you. Brain is fully functional.
Lee.
Where's Molly?
You were in an accident.
Lee, hit the brake, hit the brake, hit the brake!
You sustained a traumatic injury to your brainstem, which has cut off your brain's ability to communicate with the rest of your body.
Can you fix me? Where's Molly?
You still have movement in your eyes, so we can get you to a rehab facility where they can teach you how to communicate.
No. I can't be stuck like this.
Unless the crash didn't cause the brain damage. Maybe the brain damage caused the crash.
Yeah. I could have stopped. Why couldn't I stop?
Look at his palms. No scrapes. He didn't even try to protect himself. Suggests slowed reflexes or no reflexes.
You're not a doctor in this hospital. You are a patient.
Yeah, and
well,
you're the
it's
guy who wants to cut out my organs, and he's the guy who doesn't.
Stroke, cancer, even a simple infection. Anything that insults the central pons can do this.
Then that means I could be fixed.
You're giving him false hope. He needs to accept what's happened and work on making the most of it.
Why would he have a seizure?
Because he has cancer.
His brainstem is compromised.
Why are you still arguing with this guy?
Hey.
You thought I was dead.
Welcome back. And nicely played. You almost died. Exactly as we planned.
You knew this was gonna happen?
Usually happens when you treat cancer by pretending it's not cancer. Right, doctor? My turn.
It's cancer.
No, it isn't.
Yes.
Small tumor in his brainstem causing paraneoplastic syndrome. He needs plasmapheresis.
Can you give that to him?
No, I'm sorry. I completely disagree with Dr. House.
Please shut up.
I don't. Just means I can treat him.
Let him. Let him.
Is that what you want?
Absolutely.
Could you send up a couple of bellboys?
Easy questions. You'll be done before you know it. Is this equation correct?
What, sir? If you make a mistake, I'm not gonna know that anymore?
Are these lines parallel? Spatial relationship's intact. Take a look at this circle. Is more than half of it shaded?
Of course.
Don't forget to blink. Is more than half of the circle shaded?
Sorry. Yes.
Look at me, Lee. Again. Is more than half of this circle shaded?
Blink. Come on, Lee. Blink.
Look back out.
Can I blink? Can I blink?
One way to communicate, now that's gone. Well played.
Brain biopsy reveals severe damage to the myelin sheath. The question is why?
Epstein-Barr, coronaviruses, malaria.
He runs a business, meets a lot of people. Could have picked up rotavirus.
You report having bloody diarrhea?
Wife's not sure, says he doesn't complain.
Did you ask him?
We prioritized. He can only blink. A real history would have taken weeks.
If he had Epstein-Barr, he'd have belly pains. If he had coronavirus, he'd have headaches. 5 other yes/no questions. Maybe we'd know what treatment to give. What treatment would kill him. Unless he's already dead.
Maybe there's another way. Brain-computer interface, better known as BCI. The goal is to get you to move that cursor with your mind. When you think up, the computer records the pattern. Think up enough times, it eventually learns what you're thinking. So, start thinking up.
Metal filings. Judging by the color, I'd say cadmium.
Which he'd aerosolize with the broom, then right into his lungs. Heavy metal poisoning explains everything. The chelation will scrub the heavy metals out of your blood. If we are right about the cause, we should see some movement in about a day or so.
Can't put this thing on turbo? Getting a little anxious in here.
Somebody will be here at all times to irrigate your eyes, keep you company, hopefully help make the time go quicker.
Hand me the fluorescein stain.
What's that mean?
Epithelium looks torn. These drops sting. I'm gonna close your left eye to keep it protected.
Ow.
I'm gonna blink your eye a few times to distribute the dye. Ulcerative keratitis.
Means it's not cadmium poisoning.
Which means you don't know what's wrong. Again, something's wrong.
Into your spine.
No, my chest. Something's wrong. I think I'm.
Pull the needle out.
Oh God, fine.
Call the code.
Itchy foot? It's liver failure.
The liver's fine. His enzyme have been normal since we admitted him.
I didn't say failing, I said failure, just like you. Liver is like a cruise ship taking on water. As it starts to sink, it sends out an SOS, only instead of radio waves, it uses enzymes. The more enzymes in the blood, the worse the liver is. Once the ship is sunk, there's no more SOS. You think the liver's fine, but it's already at the bottom of the sea.
So dying liver released toxins, damaged the nerves, led to locked-in syndrome.
Now we just need to know what's causing the liver failure.
Liver plus eye plus kidney, most likely sclerosis and cholangitis.
Oh, God, if only Talbot said that. Would have been a happy ending. Do a biopsy to confirm.
I'm gonna numb up the area where we'll go in for the punch biopsy.
Where's the new bracelet?
I'd rather have it at home in the jewelry box than getting peed on at work.
You got the patient's urine on that arm?
When I was putting in the catheter. Why?
You've got a rash.
The bracelet's real.
I figured. So, what if the rash isn't just a rash? What if it's an infection? If there were rats in that basement, then the liver failure could be caused by leptospirosis. Transfers through urine. Rat pee to him, his pee to you. The infection would need an entry point. Look for any recent scratches, cuts.
Look. Next to his fingernail.
The infection destroyed your liver, which released toxins that caused the locked-in syndrome. You were dying of a paper cut.
I hope you're right this time.
We found rats in your buddy Dave's basement. Tested positive for leptospirosis. Means we're on the right treatment. So, try moving a finger. I'm sure you've lost hope. I know we've told you several times that we knew what this was, but this time we're right. Concentrate. Move one finger for me.
Do you wear a seatbelt? Is that really relevant to a seizure?
Skip it.
How about, were you vaccinated for polio? I think you gave me the form intended for FDR.
We're like teeny tiny Mo in the fifth.
I went 4 for 6 yesterday. You want winners? Cure me first. Are you generally satisfied with your life?
It does not ask that.
You know, I was going to ask what a respectable doctor was doing in an OTB parlor. Somehow that question doesn't seem relevant anymore.
What's your excuse?
Turns me on.
Yeah? What else turns you on? Drugs? Casual sex? Rough sex? Casual rough sex? I'm a doctor. I need to know.
No sex. Just moved here. Haven't even found a job yet. Don't know anybody.
Came here without a job. That means you didn't move here. You moved away from somewhere else. Does that hurt?
No.
Are you on prescription meds, hormones, prednisone?
I already answered that one. I think it was question number 20-something.
Well, yeah, and I could reach down and get it, but that would kind of spoil the whole cool move.
I'm not on any medications.
You vegetarian?
No. Why?
Because you might have something called Cushing's syndrome, which basically means that...
My pituitary is overproducing ACTH, which is causing my adrenal glands to push too much cortisol into my bloodstream.
What a coincidence. I'm a doctor, too.
Yeah, I had it last year. They did brain surgery, removed an adenoma from my pituitary.
Huh? What did you just say? You were right, House. Her pituitary tumor regrew. It is Cushing's. Uncanny how you do that.
Actually, it was Cameron's idea.
Nope. Cameron had 3 ideas. I chose one to encourage, to nurture.
Yeah. You're all about the nurturing.
You need a hug.
I don't don't see any regrowth. You get a medical records faxed over?
Work smart, not hard. That's my philosophy, boss.
Take that as a no.
Annika, I need you to stay completely still.
Sorry.
Still don't see anything.
Okay, so it's a microadenoma, too small to see.
So small, it's not even there.
Right. It's just a coincidence that I predicted a rare condition that she happened to have a year ago.
Results from her LP back yet?
Didn't do an LP. Knew what she had.
Go do the LP.
Okay, I need you to roll over on your side, kiss your kneecaps.
Party time. I thought it only took one doctor to do this.
I'm observing.
She's here to make sure I don't paralyze you.
You've done this before, right?
Successfully.
He's kidding. He's an excellent doctor.
I'm gonna numb the area with some lidocaine, and then we're off to the races. See what I did there? I used horse racing jargon to make the patient feel more comfortable. Okay, here we go.
Ow!
Felt like bone. Does that hurt?
A little bit. What are you doing? Ow!
Try rounding your back a bit more.
Perfect just the way you are. Oops, that was all me.
Ow!
Might want to move down one vertebra.
This is actually much harder than I remember.
My chest feels a little tight.
Try taking a deep breath. Dr. House, maybe I should take it from here.
8th time's the charm.
You trying to piss off Foreman?
Just let...
BP's 240 over 140.
Turn that thing off, will you?
Take the needle out. Take the needle out.
Hey. It's a hypertensive crisis. Start her on an IV low-pressure drip. Titrate to systolic less than 140. She'll be fine. Cameron, meet me in my office. You have aplastic anemia.
What, are you trying to scare me now?
Means you're not just sick in the head. The problem is, the rest of you appear as well, so I gotta make you seem as sick as you're supposed to be by injecting you with a drug that simulates the symptoms that you actually have. All you need to know is, you've hit the Munchausen's jackpot. I'm gonna give you a cocktail of insulin for seizure and colchicine to kill your white count. This will absolutely confirm my diagnosis of aplastic anemia. There is one small catch. If you've actually done something to yourself to cause the anemia, then I'm wrong. And if I do what I plan to do, then the treatment will kill you instead of saving you. So I need to know, have you been taking anything besides the insulin, the ACTH, the pills Cameron left in your room?
No.
Good. Give me your arm.
It was my mom. She had MS. She was in and out of hospitals all the time. People were always trying to do things for her. Bring her food or brush her hair or make her happy. People cared. She died when I was 16. And there was no one.
Boo-hoo.
Where are you going?
Well, I obviously can't be around when it happens.
Well, what are you gonna do? You're just gonna...
Relax. You know the drill. People walk by here all the time. You'll be fine.
Who are you?
I'm Dr. Foreman. I'm in charge of the case. You have aplastic anemia, which means your bone marrow is shut down. Your body can't make new blood anymore.
Are you sure?
I went back and checked your whole records. It makes sense. The aplastic anemia has apparently been developing for months. I'm sorry. We should have caught it earlier.
So, it's not just the latest white count that's leading you to feel this.
I know this is scary, but a bone marrow transplant could cure you.
A marrow transplant could kill me.
The other option is weekly blood transfusions, injections of GCSF. It's a lifelong regimen.
Yeah, I don't want that.
You sure? I don't want to be cruel here, but you've jumped through a lot of hoops to get this sort of attention.
I just want to be healthy.
It's not so much fun when you're actually sick.
No.
We'll check the registry, see if there's a donor match.
Thank you.
We have to kill all the old bone marrow before we give you the new stuff. You'll have no immune system. We'll keep you in a sterile room for 2 weeks to make sure everything's dead. Then we'll give you the donor marrow. It'll take another couple weeks until it takes hold. You won't feel a thing. If you get uncomfortable for any reason and need to talk, don't yell. Walls are 4 inches thick. Lead. Use the microphone. You ready?
Okay. Where's Dr. House?